All right, we're moving on in infancy. We're going to start out with just talking a little bit about emotions and basic emotions in the first 2 years of life. Then we'll get into our discussion, and then we'll kind of finish up with things like looking at temperament and attachment and getting a little bit into some of the theories. So, what are emotions and what emotions are present in the first year of life and then in the second year of life? Are these things that are inborn, or do they develop over time or through experience? What we know about emotions in infancy has certainly changed quite a bit over the last 50 plus odd years. I used to think that babies didn't have the same kind of feelings that we have, that like that they didn't even feel pain and that kind of thing, which is kind of hard to believe that people didn't view infants and children in that way. But an emotion, obviously, is some kind of feeling or affect, and it's really experienced. You have embodied emotion that you yourself experience, and then we can display emotions. The more complex emotions, sometimes an individual themselves doesn't even know exactly what it is that they're feeling, especially at a very young age, because they don't have those cognitive capacities built up in their frontal lobe yet to quite understand what it is that they're feeling. And then we as adults, when we are watching babies and young children, we may not always know what they're feeling by looking at them. Obviously, this baby here on the left that's laughing, we see this universal facial expression, and this is one of the basic emotions we see at a very young age. Between 4 and 6 weeks, you'll start to see smiling and laughter. If you see it before 4 weeks, it might be a little bit more of a reflexive response. But this is definitely what we would call a social smile. The baby is reacting to the parent, to the caregiver, and it's a reciprocal thing that's happening. Her mirror neurons are firing, but then she's probably experiencing that emotion. She's having some kind of embodied emotion, and we see that in her expression. This boy here on the right, it's really kind of hard to say what emotion do you see in looking at his expression there? Sadness, shock, worry. It's really kind of subjective in what we're trying to figure out what this infant is experiencing. What is he expressing? And certainly at this age, he's probably, has limited language at this point. It's kind of hard to tell how old he is, but he's probably not even able to articulate it. So this is where, responding to infants and emotions can get a little bit tricky. And when they start to get verbal and they're hitting their second year, it's a relief as a parent or as a teacher, if you're teaching, in a daycare or a preschool program, for them to tell you what it is that they want or need and get past that frustration, because you can imagine the frustration between them having an emotion or feeling some kind of experience and they can't properly convey that to the adult of what it is that they need. So that comes with time. But then even sometimes, an 18-month-old, a 2-year-old really doesn't know what it is that they're feeling. And then that's where it might turn into some kind of temper tantrum. And we'll talk about that next week. What is a temper tantrum? And when the crying spell is over, the adult should ask the child, to try to identify the emotion. Was that sadness? Was that anger? Was that frustration? And sometimes they themselves don't know. And sometimes if they've really spiraled out of control, they will have forgotten exactly what triggered it even. So we try to teach self-soothing skills so that they can start to understand their emotions and calm themselves down. But definitely infants are expressing the basic emotions of happiness or joy, sadness, and you get pain that get in there along with sadness, or anger, frustration. We start seeing those things. And then in the second year of life, you start to see more complex emotions. but it also does really vary in their natural temperament. We see temperament in babies at a very young age, and psychologists believe that temperament is the basis for personality. And it's really hardwired. It's part of your nervous system. How emotionally reactive is this baby is largely inherited from their parents. And they know that in looking at twin studies, but then also retrospectively, you can look at your developing child and think back to how they were as an infant. How emotionally reactive were they? How easily could you get them to calm down when they would cry and you would pick them up? Were they always fussy and irritable? And then you kind of see that continuing on through childhood. Jessica, you had a question? Your neurologically based temperament, we really believe that that's something that you're born with. And Carl Jung was the personality theorist who first studied this and said this is something that's neurological. A lot of theorists after that have built on that, and it's a little bit difficult to study sometimes, but personality tends to remain fairly stable. Certain dimensions, things you may become slightly more extroverted or more open, but one of those traits like neuroticism, which is essentially your emotional stability, that remains pretty stable. If somebody is naturally a little bit neurotic, if they have a stressor that happens to them, some kind of trauma or just too much of a demand on the system because of things that are going on in their life, they may react to it more negatively than someone who is emotionally stable, less neurotic. And so a lot of our studies are retrospective, so we're kind of looking back, how was this person as a baby? And it's a little bit hard to say. It's not necessarily predictive in that sense. Yeah?
So can the temperament be affected with the mom? How some moms just won't put down their kids ever, and their kids get really fussy and really attached to their moms?
So,
Or is that more like a personality?
So can temperament be affected by how the parent is reacting to the baby? I would say it's a two-way process. So if the baby is maybe naturally fussy and the parent picks up the baby and then is constantly holding the baby, then yeah, you are kind of encouraging that behavior. This is where it's like a behavior genetics. So you start off with some base points, and then the environment is reacting to it. You could grow out of it. So, I think we'll talk about the different types of temperament that we see in babies and in young children. But sometimes if you are raising your biological children, it's really almost impossible to separate out how much of these things about temperament or personality are coming from the genes and how much are coming from the parents' influence. And if a baby is really fussy and you talk about, oh, my fussy baby, and then you treat them like a fussy baby, then you may be actually perpetuating that trait. We always said Camden, my older son, was an easy baby. We thought he was easy because I could pick him up. He would always stop crying right when I picked him up. But I would have to rock him all the way to sleep. This is when he was an infant. But really, probably up to over a year, he would need to be pretty much asleep for me to be able to leave the room. So nap time sometimes was, an hour long or more process getting him to nap. And we'd have a routine, but in my mind, I didn't have anything to compare it to. So I thought he was easy because he wouldn't scream and cry. He would stop crying. He just wanted me to hold him and rock him. And then I'd rub his back, and I had this whole routine. I remember standing over his crib Once they get older, it's safe for them to roll over and sleep on their tummies. You want them to sleep on their back when they're newborns and very young. Once they're really capable of rolling over, it's okay if they sleep on their tummy. So he'd go down on his tummy. This is when he's maybe about a year old. And I just remember standing over his crib, being like exhausted, and rubbing his back. And I would rub his back, and then I'd kind of start to slow down, and then I'd wait to see if he was moving, and then I'd do this sort of, lift my hand up very slowly, and then I'd walk out of the room backwards really, really quietly and kind of creep out, and then shut the door really quietly. And I thought that in my mind, I thought, well, he's easy because I can get him to go to bed. I hear stories of parents who have their baby is screaming while they're holding them and still screaming and crying for hours. So, and there's a number of different reasons why a baby might do that. So I thought, oh, he's easy. Well, then when we had Quentin, I kind of started out doing the same routines because that's what I was used to. But also I was a more confident parent because I'd been through it. And I was kind of less worried about him in general because he was so healthy when he was born. Not that Camden wasn't, but I guess it just kind of eased up a little bit because I'd been a parent for 4 years already. And plus I was really tired because I had the older one that I was also taking care of. And John and I, we have equal parenting. I mean, sometimes I go, oh gosh, I need to step up because John's doing a lot and I need to step up and do as much as he's doing. So, that's an advantage to have two parents in the home, obviously, because you can then share in duties. But I remember Quentin, by 6 weeks old, I could lay him down in the crib and he would be drowsy. His eyes would be dropping and opening and dropping and opening. And I'd see his eyes drop and I could do the very slow back away and his eyes would still be kind of opening, closing. And I could leave the room at 6 weeks old. And I said, oh, this is an easy baby. Camden's probably more typical, more textbook. And but then at the same time, like with your question, how is the parent's reaction then continue to shape that? So then we're like, oh, Quentin can get himself to sleep. So he cries at night, and we say, don't get up yet. He'll get himself back to sleep. So we don't quick and run and jump out of bed and rush to him to pick him up. So we would probably, we'd listen to him cry. And, a minute of a baby crying seems like forever. It's only a minute. So you look at the clock and you go, okay, he's been crying for a minute. It seems like a really long time, and it kind of pulls at your heart. You're like, oh, should I get up? And John is definitely like that. He's very, his emotional reaction is, I need to go to him. And I'm more like, wait, just wait. Give him a chance. Give him a chance. I just fed him. He's not hungry. And so we would wait. It's so funny, like laying in bed and like, trying to be quiet. Especially when our first one, we lived in an apartment. So like the baby is like right there, and when now we live in a house, and Quentin, it was a house, so it was down the hall, so then you could kind of talk more normally. But yeah, I mean, I think that definitely how the caregiver is reacting to whatever innate temperament you might foresee can continue to shape that and perpetuate that. So, is Quentin a more patient kid because we made him wait? He might be. He might have a little bit. Boy, that kid, he can wait in line. He's really good at the self-control task. I did the marshmallow test with him when he was, I'll show you the clip next week. Some of you guys have seen it already, where at age 2, he sits at the table, and it's a classic psychology experiment. How long can they wait to eat the marshmallow? And Quentin could totally do it. He's just like stone cold, just sitting there, just staring at it. Actually, I used M&Ms, and he's just staring at it, like, so it's a really great question. It's absolutely got to be bidirectional, but the temperament studies, they really, when they compare a child that's been adopted into a family, and then they do a personality inventory and compare them to their biological parents if they have that access, then that's where they see a lot of similarities. And so it gives some credence to the importance of inheriting some of these basic things. Okay, so there's also cross-cultural influences. So we have the universal emotions that by age 1, all infants have those 6 universal emotions. So we mentioned there's happiness or joy, sadness, anger, surprise, fear, and then the 6th one is disgust. And so an 8 or 9-month-old doesn't express disgust. So another classic psychology experiment looking at emotions, they will put what looks like a log of poop on a plate, and they'll put it in front of a 2-year-old, and the 2-year-old scrunches up their nose, makes that universal facial expression of disgust, and goes, and you want it. As do older children and adults. Get that off my plate, get it out of my sight, right? A 9 or 10-month-old will reach for it and test it out and taste it. Of course, it's chocolate, right? Because in the experiment, it's chocolate. So that doesn't come until a little bit later. But then, so those facial expressions are all universal, but then when and where we display them is dependent on the culture. And the child just sort of picks this up. They get the cues from the older children and the adults in their environment. When is it appropriate to make eye contact? When it is appropriate to smile? And whether we know it or not, we are constantly shaping that and encouraging that. And it's in the television programs, but it's really in our interactions, with the infants. And the brains are pre-wired. We really think that this mirror neuron system is in place to copy, to become social and communicative, right? You need to have your needs met, so you got to look at the person, to get the message across of what it is that you need. All right, so we see those basic emotions in the first 6 months, and then by age 1, we start to see some more complex emotions, but then really in the 2nd year, so between age 1 and 2, we start seeing these secondary emotions. So jealousy, empathy, embarrassment, pride, shame, and guilt, they're the self-conscious emotions. And they don't have facial expressions that match up with them. So we as adults don't know what the child is feeling. And because they are more complex, the infant, him or herself, may not know what it is that they're feeling or experiencing. But then, as adults, we use some of these emotions, both the basic emotions and these secondary self-conscious emotions, to shape behavior. What's socially acceptable behavior? What is what's the empathetic, what's the nice way to behave and play? How are we going to share? And then if kids don't share, so, if you don't punish babies, okay, right? We don't put an 18-month-old in timeout. They do not have the understanding, the complexity in their brain development to put those connections together. So we just try to encourage positive behaviors, and we do use those basic and secondary emotions. You want them to embody it. They have, and I mentioned this, I think the very first week, empathy is something that we think might be sooner than things like, jealousy or shame, but actually empathy, feeling for another person. You imagine yourself in their situation and you feel for them, and that might be, more apparent in some children than others, but we can certainly teach those emotions and shaping them by giving lots of, good job, that was so nice that you're sharing, and and you know, the guilt and the shame, those are things that are just naturally going to emerge. And oh boy, I mean, Quentin's 5 now, but just I think it was probably a couple months ago, he did something. I totally can't. It must not have been that big of an infraction because I can't even remember what it was. But he did something, and all I said was, "I'm really disappointed in you." And he just started bawling. He started crying. Shame, right? That was shame. I mean, I shamed him in a tactful way, I suppose, right? But, you know, you want to humiliate him or anything. All I said is, "Are you really disappointed?" So it's kind of amazing how powerful those emotions are, right? Oh, yeah, so here's the baby. We can say, oh, is this baby on the right showing empathy for the baby on the left? It's subjective. We don't really know what's going on here. Maybe she's just curious. What's the matter? You know, why? Or maybe, but she's not going, stop, you know. I just kind of a fun little picture there showing this, what might be a complex emotion. All right. So, stranger anxiety. Okay. These little girls are, you know, they're probably about a year old or a little less than a year old. And stranger anxiety or stranger wariness happens in all children. Less so if they go to daycare because they're kind of used to maybe new people. But it's totally normal. They're like, who is this? What's going on here? And it emerges kind of gradually, but then depending on how the other people respond to their crying is going to determine how long stranger anxiety lasts. And, you know, is this going to be like this temporary thing, little phase that they go through just for a month or so, or is it going to last for 6 months? Largely depends on how the other adults are reacting to it. You know, when they have that stranger wariness or stranger anxiety, they will look to mom or dad or whoever they know, and they will look at their face and that's called social referencing. Is this somebody that I should go to or not? And then depending on how mom is responding and how the stranger's responding. I don't know, Santa here is looking like he's not too thrilled. I don't know, he's got it looks like a fake beard. Not as good as our Alderwood Santa, right? The real beard. But how they react is going to change the situation. So if you are taking your baby to a babysitter or daycare for the first time at this age, you're going to have probably, you know, a bigger reaction in their wariness when they are dropped off. But parents should know that if they are leaving them with an experienced child care provider, they know how to respond to this. They know they hold them, they get them interested in looking at some toys, talking to them in a soothing, calming voice, and mom or dad or grandma or whoever's dropping off should give a hug and a kiss and say, I'll see you, I'll pick you up at 4 o'clock or whatever. You know, you may reassure them that you're coming back, and then you should just leave. The longer you stay and drag it out, actually the more emotionally draining that is on the baby. And I know sometimes if it's the first time that you've dropped your baby off, like if you've been home, gosh, if you've been home with them and taking care of them 24 hours a day for a whole year, and this is actually harder on mom than on the baby, because the baby will very quickly get interested in whatever new toys or activities or interesting things that the babysitter has there, and then it's probably harder on the parent. But if you have your baby going to a daycare center or child care provider around 3 or 4 months, which is really typical. I think that's how old. Camden got to stay home a pretty long time because he was born in May, and then I had all the summer and went back in September. So he was 4 months old, almost 4 months old when I went back, but he wasn't at this stage yet. So, you know, he went right to the lady, and then I went in my car and cried. But then it was okay. There's a lot of, it's kind of a weird experience for the parent because you feel some guilt, but you just have to trust that it's going to be okay, right? It's actually harder for the baby to have them go later, if that makes any sense. Of course, you want to have a good babysitter, okay? So separation, so that's what we're talking about this. So stranger anxiety, but then even, say they go to the same babysitter every day, there can be, at about this age of around a year, there can be some separation anxiety every single morning. And so that depends, again, on how quickly you want to reassure the baby. I absolutely do not condone sneaking out. I think that's tricky and mean to do to the baby. You want to really make sure that they get a goodbye and that you reassure them, or you say, Dad's picking you up, bye-bye, love you, and, and leave, and do it, try to be consistent, do it the same way. Camden was more slow to warm up. I would have to read, we'd go over to the story area, and I would read a book with him. So I had to plan that in my drop-off routine so that I wouldn't be late for work, and that just became part of our routine. Quentin, easier. He's like, sometimes I have a hard time getting a hug out of him. I'm like, hug mommy, and he's like, I'm going to go see my friends, bye. Priscilla.
So is that more common in babies or in toddlers? Because I can remember when I was in preschool, I was maybe 4 years old, and I still remember it. This girl got dropped off at the preschool, and she just threw the biggest tantrum scene because her mom was leaving her, and she wouldn't get over it, even if the teachers were like, here's some crackers, here's this.
Right, so that gets back. So older children can certainly have separation anxiety. It gets back to their individual temperament, which we'll talk about next. Are they difficult, if it's a difficult child or a slow to warm up child? Or is this new? Have they been with mom pretty much at home for 4 years? It's going to be a lot harder that's a huge change. But any transition is a change. Going from, a daycare provider to a preschool, and then going from preschool to kindergarten. Those are all transitions, but depending on the child's temperament and personality, and then depending on what they've been doing prior to that transition is going to depend on how they react.
It's not like a development problem in a sense, like if you're at that age and you still don't know really how to let go, it has nothing to do with that.
It could be some kind of sign that there's developmentally something going on. But difficult children, and then there's also a difficult to categorize temperament, because they're sort of all over the place. They're sporadic in their reactions. And, if it goes on for a great length of time, now, if school starts in September and you've been having these problems, especially, let's say it's kindergarten, pre-K or kindergarten, developmentally, they should be able to self-soothe, calm down, focus, listen to instructions. Even at age 4, they should start to begin, but in small amounts. You cannot expect them to sit for an hour, okay? But they should be able to sit on the carpet for 10, 15 minutes and do something as a group and not be losing it. So if this is continuing on now for, several weeks and beyond, now that's going to be it's a huge distraction for the teacher and for the whole class if it's in that kind of setting. I would think that's probably less likely to happen if it's a one-on-one babysitter type of situation. But then you go, okay, what's going on here? Is this neurological, something going on with the baby neurologically? Is there some kind of emotional issue or behavioral? And then they might need to get assessed. When we'll talk in 2 weeks about ADHD, which is a very common disorder that we see in childhood, whose job is it to tell the parent there's something off, you need to go get checked. That preschool teacher, if she can't run her classroom because somebody's screaming and crying and throwing stuff, then she should say something. You got to do something about it. Should she be the one that says, I think your child has this? No, right, because she doesn't have those credentials, those qualifications. Even though she might be right, it's the pediatrician and the specialists that make those calls. Yeah, you could totally offend someone. Absolutely, yeah. My best friend that I met at UW, I've known her for over 20 years. She has 2 boys, and her older son had all of these the problems that you're describing going to preschool when he was 3. He had a one-on-one nanny at home up until that point. He had a strong attachment to the nanny, strong attachment to his mom and his dad and his grandparents. And then he goes to the preschool, and he was just out of control, had no emotional regulation, throwing things, really difficult for the teacher to know what to do with him and control him. But then the teacher made that fatal error of saying, I think your son is autistic. Okay, that's a little, you want to say it in a different way. I think there's something going on with his emotional regulation. He's not able to control and calm himself down. He seems really sensitive to the noise and the lights in the room. And just describe the behavior they're actually seeing. Don't give it a label. But my friend was, she was shocked and like, who are you? But she knew something was wrong. Yeah, he knocked down a whole shelf of books at the school and threw a chair. So she's like, okay, yeah, we got to do something. So they went to Children's Hospital and had an assessment. And it's taken a long time. He is now almost 7. He got his diagnosis last year. He has autism. So is she going to go, back to that preschool and say, you were right? It just was probably more emotional and traumatic than it needed to be with that sort of feeling attacked. But yes, he does have autism. Okay, so I did have a picture of, what's his name? Who ran against Obama in the last? Mitt Romney. Mitt Romney is a dad and everything as well. But there was a funny picture of Romney holding a baby and making this stink face, like a holding the baby out from him. I thought it was kind of funny comparison. But I don't know that he's bad with babies, but Obama, he's like, he's got the babies holding, but he's looking at mom, right? And so this social referencing, you say, the president is so good with babies. Well, the baby is comfortable because he's looking at his mom, right? And so it's a nice little shot there, right? You go to these baby classes, and it's sure as it's socializing. The babies aren't really socializing with each other. They're getting lots of social referencing from the other adults. I mean, in some way they do a little bit of parallel play at this age. You've got the babies, so you go on a play date, or you go to this might be a play group, a circle group. I went to a baby and mom yoga group for a little while, and it was kind of hard because the baby's rolling around on the mat and you're doing downward dog on top of the baby. And I think it really actually is just it was kind of a way to meet other women that were in the same phase of life as you. That's kind of how I saw it, and I made a couple friends. Were the babies getting anything out of it? I mean, they're just learning and experiencing how to interact around other people, perhaps. You know, it's a lot of social referencing and feeling comfortable and understanding that these cues. So see, she's giving the mom with her boy here on the left. He's like unsure, or he's looking up at her. What's going on? Who are all these other people? And why are we sitting on the floor? And she says, it's okay. This is fun. See, we're doing yoga. I don't think they're doing yoga, but okay. All right. So then, when there's a lot of different studies out there that try to classify and then measure temperament, but temperament is really thought to be these inborn differences, your emotional reactivity, which then becomes emotional stability. And if you're really not emotionally stable, we call that neuroticism. Have you ever met an adult that's really neurotic? You can almost hear it in their voice. They're like shaky and like, oh, you can, I mean, they worry all the time. And it'd be interesting to find out, what were they like as a baby? Was that, something present early in life? But because of epigenetic forces, the environment is constantly interacting and either pulling out and strengthening certain maybe hardwired temperament traits, or discouraging them and reshaping it. So most kids are easy. They are comforted when you pick them up. They, respond to routines. Consistency is really important. If you have a different drop-off time and a different pickup time every day, a different person is picking them up, who are we staying with today, what you have, I'm with grandma today, I'm with a nanny tomorrow, I'm at the sitters the third day, that kind of inconsistency, then you go, okay, epigenetic forces are really probably going to be powerful when you don't have that consistency. When you've got, a routine, consistency, most kids fall into that being an easy child. They respond and react well to their environment. Only about 10% categorized as a difficult child, so they are hard to soothe. You can't console them. And there's a number of different reasons why. I mean, early in infancy, they could have some GI discomfort. We kind of loosely call that colic. Colic is really sort of unknown. Is this sort of a gas pain that the baby has? Will the colic work itself out? Usually it does. But then when they get, to be closer to 1 and 2, if they just cannot adjust into a new environment, they might be classified as the difficult child. The slow to warm up child is a smaller category, about 15%. And the thing is that with the slow to warm up child, sometimes they may not be getting their needs met because they're not disruptive. There's no problem. They don't act out. But they maybe aren't participating. So, we're talking this getting closer to maybe 2 years old. So they go to their preschool or their daycare center, and they just watch and they don't play or participate. And it takes or they want to go over in a corner and play by themselves, and then slowly maybe acclimate to the group. So, preschool teachers need to be aware of those kids, because are they really, are they getting their needs met? They want to be part of the group. They just need to slowly sort of build up to it. And I definitely have come to accept that Camden is slow to warm up. Okay, what is it, January? It's January, end of January. He's in 4th grade, and he's finally making new friends in his class this year. The very first day of school, he says, I don't have any friends in my class. All my friends are in other classes. And I said, well, you'll make new friends. No, I won't. I'm like, what? And, so I go, well, who do you play with at recess? I don't know. And he won't talk to me. I don't know. What do you do at recess? Play soccer. Well, you're playing soccer with other, because I'm concerned, because I'm like, I don't want him to be that kid that's dribbling a soccer ball over in the corner of the play yard by himself, because I could kind of imagine him maybe doing that. And he said, no, I play with just some of the other guys. I'm like, okay, some of the kids. And finally, he started talking about a particular kid just this week. The thing is, and he's very introverted. So, and as a little kid, when he was a baby, we would drop him off, and like I said, I'd have to read the book and transition him at drop-off. That's slow to warm up. Swim lessons, first time doing swim lessons. You know, if it were a new teacher or a new pool, even though he'd already been going at whatever other place, he would shake his head and look at me, and I'd say, you need to just sit on the edge of the pool then. You can't sit on the bench with me. You have to go sit on the edge of the pool. And so finally I'd kind of push him over. He'd just sit on the edge, and he would be looking back at me, and he'd be shaking his head and looking uncomfortable, and so then I would leave, and that was let the swim instructor do their job, and I would say to him, I'm going to go over to the other room. Parents shouldn't be in here. And even though there's other parents there, I said, I need to go do something else. You listen to your teacher. Okay, and so, and then I would be in like the weight room looking through the window, and within 5 minutes, he's off the side of the wall doing bobs. So maybe that gets back to your question about how the parents react, you know. Yeah, it does depend on, so he's still got this, he's still like that. He's a little resistant, but then because of those extroverted, more outgoing kids, they come up to him. They'll grab him and say, come be on our team. Thank goodness for the outgoing kids, right? Okay, yeah, Kaylee?
Do you think that kind of behavior is more like prevalent in only children or like firstborn children because they're not around like another child all the time?
There are some studies that try to look at what, do firstborns have firstborns are they more extroverted, or are they more like leaders, if they have younger siblings, if they're an only child, or I like to call them singletons because only makes it sound like they're lonely. So the singleton child, what kind of personality traits? Sometimes a singleton is more self-efficient because they have had to they don't have playmates in the home, so it depends on what their other social interactions have been. If their parents have provided those, play opportunities with other kids, or did they always just do everything with adults, then they might have a little bit harder time relating to adults. But most singletons get right into, they seek out other kids. Like when you go on vacation, I know my brother-in-law doesn't have any brothers or sisters, and I think he said that either he would be allowed to bring a friend on vacation with them. I'm like, oh, then you've got to pay, they got to pay for this other kid. But it's like going camping or something, right? But even if it was just him with his mom and dad, and they're camping, say, in eastern Washington, and he's on his bike, they have their bikes, then he'd go find other kids. And actually, my brother-in-law is extremely extroverted and outgoing, and makes friends like waiting in line at places and stuff like that. Like that's the type of person he is. I have a cousin who's an only child who has some social deficits and doesn't do well interacting and meeting new people. He tries, and then he's just not so good at it. But that's probably more just his individual personality. So I don't know. There's a lot of different studies that you can read to say, oh, what type of birth order correlated with a certain personality type or temperament type. Yeah, Michelle?
My sister was classified as a difficult child. Like her nickname was Smog as a kid.
Oh.
She was hard. But when I was born, my parents considered me an easy kid, but because she and I entered the same room growing up, her difficultness, is it possible that she can transfer that onto the to the baby, the way she acts around the baby? Because my mom said that after when we were in the same room, I became difficult, but once you separated us, I went back to being easy.
Yeah, so you are learning through observation. You definitely, and it gets back to epigenetic forces. And when you're living with your biological parents, it's hard to know how much is a reaction from their modeling behavior, and how much is an innate predisposition. Your older siblings influence you all the time. I'm a pretty competitive person, but my older sister wasn't growing up. So, and my parents probably did and said things that you shouldn't, like compare kids. Because they would say, and the message that I got was that my sister was really smart, just naturally, innately really smart. And that Diane she was okay smart, but she worked really hard. And that was the reason why she got A's in school or whatever. And my sister would do like bare minimum, get a B+, because she was so smart. And that was like, I heard that. That's what I heard as a little kid. That's what I heard. I don't know if that's what they actually said or not, but that's what I heard. And but then I also heard them saying, if only you applied yourself as much as Diane. You should never compare kids. And my parents were wonderful parents, but, you remember these things. And so, my sister, she graduated from high school with a 3.0, and that's not bad, right? That's not bad at all. But if she'd only applied herself, she might have had a 3.5 or 3.6, right? And that's so. But luckily, she wasn't like a really competitive person. She let that not affect her, bother her. And she went on and graduated from college and everything. And I think she graduated from college with a 3.0, which again, very good, And I graduated from college with like a 3.4, which is a little bit better, but I mean, who knows? Like you compare like success. Okay, she makes way more money than I do, but is that success? How do we? Comparing kids but I do know that totally does affect your development and how you see yourself, and my sister and I are like best friends, and I think part of it has to do with that she didn't let those things bother her, or she's maybe she's like, oh, okay, well, I turned out okay, and we watched the Seahawks game together. Our whole family got together last week, and one of our second cousins she was only 42 years old. She just died 2 weeks ago, very suddenly, unexpectedly, and but she had lots of problems, and I hadn't seen her for a really long time. So anyway, we were talking about that, and my mom said, "The two of you are so normal." Oh, thank you. So, but the littlest comment can affect you and influence you. Because I still go, well, I'm only here, the only reason I, have this job and reach this level is because I worked hard. It's not because I was naturally smart. I still in the back of my head. Yeah, Priscilla.
If you have the same parents, like say, for example, me and my sister were just two. We have me, her, and then my parents. Like, if you come from the same parents biologically, what is it? Is it your genes, or what is it that makes you so extremely different personality-wise? Like, for example, my sister, when I was born, I'm the younger one, she used to rip out her hair because she was so angry that my parents were like, what do we do with her? Or she'd like rip my binky out all the time, or, she like, even today, she's 22, she'll, like my whole life, always compare me, like, oh, I look better than you do, or, oh, that fits me better, or your hair doesn't look good, growing up, she's such a hard ass, excuse my language, but
Yeah.
my whole life on anything, but I've always been more calm, like, all right, like, I might be competitive work-wise, but not.
Right. So, you have the same mom and dad. You and your sister have the same mom and dad, but they each have 20 to 25,000 genes, and, about half of that, right, gets in a number of different combinations between your mom and your dad's gametes, and every single conception, then you have trillions of possible combinations of genes. So it's almost surprising that siblings do have similarities. It'd be more likely that there would be dissimilarities because of all the trillions of combinations. A lot of times, siblings will look alike because there's a real dominance. Or like in my family, with my kids, my husband and I both carry recessive genes. We're both light-haired and light-eyed. So obviously the boys are going to have all those recessive genes. And so they do kind of look alike. Certainly their hair color and eye color is the same. Skin tone is almost the same. But their personalities are different. And we have to remember that your phenotype is including personality traits. And so that's the expression of the gene. Let's move on here. So dealing with emotions, at first their prefrontal cortex is not mature enough. That frontal lobe has all that dendrite growth going on. It's disorganized. They've got these new experiences and emotions that are emerging in the second year, and it's getting really intense. And they have to learn how to control it. They don't have impulse control yet, so they need help. And if they can learn self-soothing techniques, this is going to be really helpful for their development going into preschool then, going into their preschool years. Some kids will use an attachment object. Like this little girl has a blankie that's real soft, and she's cuddling it there. She looks a little bit worried or unsure. We don't know what she's feeling, but she's really clutching this soft blanket. And she could be using that as an attachment object to self-soothe. Other babies will begin to talk and self-soothe in that way. It's and of course sucking when they're infants. So this is where you don't want nursing or bottle feeding to become a soothing mechanism, because that's really hard for the adult, and it's also not good for them because then you don't know how much they're eating, or they're just sucking in a lot of air. Are they really eating, or are they using it to soothe? So that's where the pacifier can be good, because that is calming and soothing. And then when they don't need the sucking anymore, they can self-talk or use an attachment object. And our kids have blankets, and different toys have been. It's kind of funny. Camden didn't really have a toy, but he had this blanket, and the blanket never went anywhere. It always just was on his bed, and he still has it on his bed. And but he used to rub it between his fingers. So when he would go to bed at night, he would hold, and it's fleece, right? Fleece is really soft. So he would hold the blanket up close to his chin, and sometimes he would rub it over his lips. He didn't suck on it, luckily, because that can become a bad habit. But he would rub it over his lips, and it was so cute. And John and I would watch. We'd go, Camden's still got it. He's got his blanket. Look at him. And we'd peek in there and watch. And when he was like 2, so he'd get himself to sleep by that point. We're like, yes, yes, yes. And calm himself down. Or if he had some, kind of issue going on during the day, he would cool down, and then you could hear him talking. And we're like, I don't know what he's talking about. He's calming himself down. It's a skill. Quentin has a pillow pet. You know what those are? He's got the small pillow pet, and it's a monkey. And it's really disgusting. I have to put it in the wash every once in a while, because he used to put it in his mouth and walk around with it in his mouth like a puppy. And then he has a fleece blanket also. And they kind of go around. They're laying in different parts of the house, and then he doesn't need them. Like, he can go to sleep without them, but if he's upset, he wants it. And he uses it like a pillow. He sleeps on it with his head, but then he also cuddles it and clutches it. And it took me, I have to convince him to put it in the washer. We're like, I've got to wash Monkey Pillow. And that's what he calls it. That's its name. Its name is Monkey Pillow. And so if for some reason something happened to Monkey Pillow, he'd probably be upset. But then, now he's older, he'd be fine. He doesn't really need it. Okay, so brain maturation, and that has to take place in order for these emotions to develop. And I showed you this picture before where we need good nutrition to feed the brain and the body, a stimulating environment, an enriched environment. And this has to be with humans, okay? You have to, the only way to learn how to socially engage with others and to learn language is with people. You cannot learn language from watching it on TV. And I know we kind of skipped over language development the other day, but watching Dora the Explorer, which is mostly English with some Spanish thrown in, will not teach that child how to speak Spanish. Getting Rosetta Stone and listening to that or watching that will not teach that foreign language to the baby. You have to have a person. The dendrites they've done studies. The dendrites will prune. They will not develop those pathways. It's really interesting. Even though they're hearing the sound through the television, for some reason they need to like a three-dimensional real person in front of them to interact and have that reciprocity to really learn and develop the full language. Yeah, Kaylee?
What about for like adults? 'Cause my uncle right now is trying to learn Spanish for his job. He listens to it in the car on the way to work every day. He said it's working, but when I try to like, because I took 2 years of Spanish, so I know a little bit.
Uh-huh.
When we try to talk, he'll forget it a lot.
Yeah, I mean, I think that for adults, you know, those types of programs, you might be able to learn some basic vocabulary, but it's not social, and language is social. It's back and forth. So you really need to be with people, going back and forth. I mean, I remember when I took Spanish, oh my gosh, I remember listening to the tapes, and you'd listen to them, and I mean, that's not social. It's not communication. I'm learning some words and maybe some pronunciation, but probably not hearing it correctly and not, you know, reproducing it correctly. You need to have engagement in language. So he can learn some basics, especially if he's going to be like using that language in a written form. Of course, if you're listening, then you're not learning it that way. Yeah, if he needs to write it, then you learn it through a book. But even then, that's going to be, you're not going to know how to properly use the grammar in a conversation. Yeah.
So if you wanted your child to be bilingual, what age is like the best? Like I know my cousin, like her dad is French, but their mom didn't teach them French and English because she thought that they would get too confused.
Oh, that's too bad.
Yeah, so like
Yeah.
English and it's everything. So I mean, do they get confused?
No.
Is there like a certain age?
No, if you expose an infant to multiple languages, they will sort them out. They will absolutely, they may kind of do a funny thing where they go back and forth between languages, but their brain will eventually organize it. And an example, our neighbors, when we lived in Boston, we had next door neighbors who the mom was from Brazil, and the dad was from the Dominican. So he spoke Spanish fluently, she spoke Portuguese fluently, and they were living in the United States, so everybody knew English. They both had accents. His being from the Dominican, his accent was more of a British accent. It wasn't really any kind of Spanish accent. And then the mom definitely had a thick accent when she was speaking English. Sometimes, and her English was a tad bit broken. But these two kids, and they were twins, boy and a girl, they were fluent in all 3 languages. When they moved in next door to us, they were in 5th grade, I think. And they had been exposed to all 3 languages from birth, but really not English. English hadn't been really immersed for them until they were like 4 when they went to preschool. But English is their native language because that's the language of their culture, of their greater community, and then, of course, they were in elementary school at that point. So they had no accent when they spoke English, a bit of a Boston accent, interesting. You pick up the accent of your peers. They had perfect Portuguese with Portuguese accent, perfect Spanish with Spanish accent. And but what was interesting, sometimes I would hear, like in the summer when people have their doors open, because this was an apartment, when people have their doors open, you know, and she was, I think the little girl, she was about 11 or 12, so you'd hear what sounds like an argument. Of course, sometimes in other languages, it's not really an argument. They just talk loud, and I don't know what's going on. I don't know what they're saying. So they were having sort of an argument in Portuguese, and it sounds really fast to me. And then the daughter like yelled out in English, "No, Mom, that's not what I'm talking about." So she like reverted to her native language when she got really upset and went, you know, boom, no, this is what I want. And I thought that was kind of fascinating. But no, so the best time to learn a language is when you're learning language, which would be in infancy. But we haven't had a lot of pruning going on up to about age 7. So the best window is up to about age 7 to learn more than one language. After age 7, it becomes more labor intensive for the learner. It's not labor intensive for the infant, like at all, you know, and they'll figure it all out. So yeah, I have a friend that she's from Romania, and she wanted to know if, she's like, oh, should I speak Romanian? And my husband can speak English. And I was like, yeah, totally. And she goes, but then Kirk won't understand what it is that we're talking about. And I was like, then you can have secrets with your kid. No, I mean, but maybe he'll learn Romanian. But and I'm not sure if she ended up doing that or not. After age 7, it gets a little bit harder. And then what's really interesting is that once you hit about 14 or 15, it gets even harder. But then that's when we take our foreign language class in high school. So it really doesn't make sense. It should be done in preschool. Let's keep going so that we can have some class discussion. This is my Romanian friend. That's funny that I was just talking about her. So they live in Ohio, and the reason I have a picture of her there is this is her almost 3-year-old, Simon, and he just got an autism diagnosis. So she's been emailing me, and we've been chatting back and forth and texting, and I've been sending her articles and whatnot. And you know, the thing with autism is, first of all, if you've met a child with autism, you've met one child with autism. And I think I may have mentioned this before, but we think that there might be about 1,000 different genes responsible for autism. And that very well could end up, who knows what they'll find out in science. It could end up being 1,000 different disorders. We don't know yet. But they seem to be grouped in this similar fashion with what the symptoms are and how it's displayed. But usually the child physically looks totally normal and healthy. And so that's where it's harder to diagnose sometimes, or how other people react to the individual, because they don't know what's going on. They're like, you know, you look healthy, you look fine. Why are you behaving this way? And her little boy is he's real sensitive, and he's cuddling up with her. That's why I chose this picture. But he's almost 3, and he only has about 3 words, about 3 or 4 words. And I guess he's kind of small, and his muscle tone's a little bit weak. But he's shown social emotional reciprocity with her and his dad, but not with anybody else. So we talked about social emotional reciprocity is the give and take of joint attention. So, oh, look at that bird, and you point, and the baby looks and sees what you have shared enjoyment then in that. So that could be a deficit. Not having the eye contact, and especially like if you're pre-verbal and you want something, you're not making eye contact with the adult to communicate, this is what I want. That gets more into nonverbal communicative behaviors. They're not responding to their name when their name is called. I mean, gosh, by 12 months, if you call the baby's name, they should look up. And, always get their hearing tested first, right? But if they have hearing, then you go, why aren't they responding to their name? And then a lack of understanding in relationships. So not understanding that give and take, not getting it. So as a person with autism gets older, they may have difficulty making friends because they just kind of don't understand that give and take. Or they might not understand different social cues. So if they're having the nonverbal problems, so they don't understand nonverbal communication, they don't quite get like proximity, like how close do you stand to somebody when you talk to them, what's appropriate, what's not appropriate, do we hug everybody that we meet, do we, all of those different social rules, those social norms, even though we try to teach them, they still don't get it. And I've met adults with autism who have come a long, long way, and they even say, I fake normal. I don't like making eye contact with people, but I know that it's expected. So I'm looking at you, and it feels like somebody's poking me with needles. And they will say that. They'll say, I feel like I'm being poked with needles looking at you, and I hate it, but I know it's expected of me, so I have to do it. And then they'll look away. So there's some sensory stuff then maybe going on, and that's where you get this other category. So you have to have deficits in all three areas of social communication, and then the restricted repetitive behaviors, any two of four. And this is the new diagnosing criteria that came out in 2013. So some of the stuff that you watched and read is talking about the old diagnosing process, but it's still, they've actually been, psychologists and psychiatrists have been following this for years. It's just now finally gotten changed in the DSM, largely because the line between what they used to call Asperger's and autism was so, subjective. Like you would go to one clinician and they'd say, oh, he's got this, and then a different clinician would give him a different diagnosis. So this just makes it an umbrella to capture all of these symptoms that we see. All right, I'm going to pause this here. So in looking at establishing attachment, we really like to look back at Erik Erikson's first stage of psychosocial development. That infant is establishing trust with their caregiver. So first stage is called trust versus mistrust, from about age 0 to 2. And if the caregiver is responding to that infant's needs, comes back, they're consistent, in either picking up the child from daycare or they respond when the child cries, they come to trust them, right? So there's a bit of a crisis, but they resolve the crises. And most of us have established trust with our caregivers. And it creates attachment then. So as you come to trust that, oh, that woman always comes in here when I cry, and she picks me up and she makes me feel better, and then I get my bottle or I get what I need, and then I can rely on her. Now she's dropping me off at this stranger's house, and she reassuringly kisses me and says, "See you later." I go, "Okay," and then and the baby is well adjusted. They have established trust. They're going to have easier times transitioning, and then they can move on to the next stage. So the vast majority of children establish trust. If there's inconsistency or if there's any kind of neglect, certainly that's not going to be established. The child's going to keep getting older, though, right? So they go on to the next stage between age 2 and 4, and this is called the autonomy versus shame and doubt stage. And Erikson said, these young toddlers really want to try to figure out independence. They're trying to test things out on their own. They want to pick out their clothes or get dressed. They still need lots of help, right? They can't really get dressed by themselves. I don't think I've ever seen a 1-year-old or an 18-month-old successfully dress themselves, or it takes them 5 minutes to put a sock on, because they don't have those fine motor skills to do that. But Erikson said it's really important that you allow them the opportunity to establish independence and have some autonomy. Give them choices. Oh, we're making lunch. Do you want apple slices or do you want an orange? And I'll peel it for you. Give them choices. That gives them a sense of autonomy, a sense of, I can do this on my own. And if you don't do that, you could create shame and doubt within the child. So that's why this is a psychosocial theory of development. This little kid wants to try to put on her own, whatever those are, overalls. Okay. So all of this is kind of leading up to identity. Erikson's really important stage that probably got the most attention in psychology was the adolescent stage, where they're seeking out independence and identity. But he said that this is actually starting out in that autonomy stage, and they're establishing this sense of, I'm a separate being from all these other people and that I'm interacting with. And this can begin as early as 9 months, but more typically going into about 1.5 years old. They're figuring out, and they know their name, they respond to the name, I'm Quinn, and you are, and these other kids, and they start figuring out other people's names, and the distinctness of the individual. They start to grasp that even as early as 9 months in some kids. Right? So the best test to see if they understand that I'm a separate being and not just part of everybody's in my head with me is the self-recognition test, or we call it the Rouge test. So we see this happen at about 18 months old. So they put a little dot of rouge or lipstick on the baby's nose, and if they don't have self-recognition, they go, who's that other baby and what's on her nose? What's wrong? They might even reach out with their hand and touch their image and touch that red dot in the mirror. When they get to be about 18 months old, and this child's older than that, she's probably closer to 3, they go, that's me. And so it's self-recognition, and identity is coming out of that. There's kind of some fun studies where they do this on animals, and they find that certainly monkeys can accomplish the self-recognition task, but even elephants. But an elephant looks in the mirror and they put something on, and it reaches with its trunk and touches its head. It's kind of funny. So self-recognition, and then so we've got identity and trust establishing, and then we get attachment out of that. So Erikson said it was about because of trust and knowing that the caregiver is going to come back and meet your needs, and maybe that turns into this thing we called love, right, or concern, care. In the very early years, it's really attachment, a close emotional bond. But Sigmund Freud said that how infants become attached to their caregivers, and in particular he was talking about their mothers, was through breastfeeding, because they're getting that oral satisfaction met, and they find that pleasurable and it's soothing, and that's what's creating an attachment. Okay, we already talked about that, but just really quick, I know it's we're running out of time. The studies on that Harry Harlow did in the 1950s, I put these old clips up on Canvas, so definitely take a look at them. They're pretty entertaining. But Harlow was testing out that, looking at that difference between Freud's view saying an infant attaches because of feeding and oral gratification, and that's why they're attaching, not because they have some kind of love or bond, emotionally with the mother. So he took the baby monkeys and separated them from their mothers at birth, which I know is very sad, these rhesus monkeys, gave them a surrogate mother, and some of them had wire mothers and some of them had cloth mothers, but they fed off the wire mother. They had a bottle, and yet they created a bond and an attachment to the soft cloth mother. And so Harlow said they're attaching because of this closeness, this actual contact comfort is what's making them want to seek out their mother. It's not about the food. It's not about anything about their mouth. It's about this security and calm feeling. All right, so we're going to stop there.